Number one, what are the clinical presentation symptoms of narcolepsy? First of all, excessive daytime sleepiness. That's the cardinal symptom of narcolepsy. Excessive sleepiness is the tendency, exaggerated tendency, to sleep at inappropriate times. So, they have an irrepressible need for sleep. They express that need through lapses into sleep, like they'll fall asleep in a lecture like this, for example. They have, or voluntary, usually refreshing naps. They take brief naps that are very, very refreshing to them. Often, they have involuntary sleep episodes. So they'll fall asleep when they don't want to be falling asleep. You can imagine if this happens while you're driving, it's not such a good thing. And sometimes it's automatic behavior. Automatic behavior is when they're partially falling asleep and they do something automatically. It's like an automatism, but it's not done very well. Like somebody writing on a blackboard, will fall asleep and continue to write, but illegibly so. Number two, disturbed nocturnal sleep. So nighttime sleep is disturbed, and they have daytime sleepiness as well. And also they have REM-related phenomena related to dysregulation or disruption of rapid eye movement sleep, the first of which is cataplexy. Cataplexy is a brief, but usually bilateral, sudden loss of muscle tone. So it usually is activated by emotional experiences. So laughter, anger, something like that could trigger a loss of muscle tone. A narcoleptic could hear a joke and all of a sudden drop to the floor because their legs get very weak, or their eyes could have this lid lag, and I'll get to some of those symptoms in a couple of minutes. Hypnagogic hallucinations, hallucinatory experiences, usually visual, but it could be auditory as well, occurring upon sleep onset primarily, when they're falling asleep. They're vivid, dreamlike experiences during sleep, and sometimes they're visual or auditory as well. And finally, sleep paralysis, where they lie in bed feeling paralyzed, like they can't get up out of a still state. Typically it occurs when they're having a hypnagogic hallucination. They want to yank themselves out of the bad dream, but they can't. They're stuck. And during this time, of course, it's very scary for them, and they have these hallucinations typically of an intruder coming up to harm them or something along those lines.